Okay, we're going to discuss the other members of your gram-negative bacilli, which are your fastidious na bacteria. So we have discussed already the Haemophilus, so we'll be discussing the remaining species here belonging to your Hacek group. Okay, the H stand for your Haemophilus, the A stand for your Aggregate Bacter, your C stand for your Cardiobacterium, the E stand for your Ichinella, and we have also here the Kingella. So the Hacek group would have here the following characteristics. So number one, they are dysgonic. When speak about dysgonic, they are slowly growing, except your Haemophilus. Medyo mas fast growing ang ating Haemophilus compared with the other members. Another one, they are actually normal microbial flora found in our oral cavity. So we're expecting that one to cause serious subacute bacterial endocarditis. It's also being caused by your strep viridans. Ang ating subacute bacterial endocarditis also is being caused also here by the group of this bacteria. Another one, they do not grow in the Makonki agar. Then they are able to ferment the glucose, except your Ichinella. So Ichinella is non-fermenter. So, however, for them to ferment the glucose require here addition of our serum. And most of them are opportunistic na pathogens. So we start discussion with the A, Aggregate Bacter. So we have your Aggregate Bacter Aprophilus. Aggregate Bacter Aprophilus here, actually, former name of that one is your Haemophilus Aprophilus and your Haemophilus Aprophilus. But later on, it was then changed to become here your Aggregate Bacter Aprophilus. Speak about Aprophilus here, so Afro is actually foam-loving. So this bacteria here would love to have here a gas environment, so it would have here needing high carbon dioxide requirement. Although that's not really an absolute requirement for their growth, but they grow better in the presence of your high carbon dioxide. Aggregate Bacter Aprophilus, usually found here in our dental cavities and gingival scrapings or in your mouth part. And being belonging here formally as your Haemophilus, though some strain requires an X factor, others would have here do not require an X factor. Okay, for the gram stain, this one appears to be gram-negative Coccobacilli, most likely. Colony appears to be the chocolate agars. This one appears to be convex, granular with the yellow na pigment with an opaque zone at the center. Okay, that's we found here growing in your chocolate agar. The next one, we have your Aggregate Bacter concomitans, Aggregate Bacter actinomycetem comitans. So this one formerly being classified under your Actinobacillus, but later on it was then separated from your Actinobacillus because the members of your Actinobacillus here are urease positive. But your Actinomycetem comitans is urease negative. Okay, we have here the virulence factor associated with your Actinomycetem comitans. This one contains here your collagenase and also contains the leukotoxin. So it tries to cause damage primarily with your PMN, your neutrophil, and monocytes. Those are your WBC, which are your phagocytes. It tries to cause here your destructive periodontitis. So for those having here an acute juvenile periodontal infection that would eventually try to cause here leading primarily to your destructive periodontitis. This characterized here by the damage in the alveolar bones that try to support our teeth. At the same time, since nasa oral cavity natin, also try to cause here your subacute bacterial endocarditis. We have here the colony characteristics. So this one try to ferment your glucose. This one do not ferment your sucrose. Do not ferment also your lactose. So we have also here, it is catalase positive, oxidase positive, and then you have your urease negative for this. Okay, then we have here the morphology characteristics of your Aggregate Bacter actinomycetem comitans. So we have the gram stain result. This one appears to be Coccobacilli. Then we have here the bipolar staining. You call that one your Morse code appearance. Colony characteristics, again, this one do not grow in our Makonki agar, only grow here in your SBA or even your chocolate agar. So after 24 hours, would appears to have here a star shape, having 4 to 6 star points at the center of the colony. And in the broth medium here, it appears to be granular, which try to adhere to the side of your tube. Next, we have your Cardiobacterium hominis. Okay, the Cardiobacterium hominis would try to produce here an oral infection, primarily for those patients having poor oral hygiene, and those patients also having here dental surgical operations. And at the same time, since nasa oral cavity natin, also try to cause here your subacute bacterial endocarditis. Okay, we have here the characteristics of your Cardiobacterium hominis. Again, this one, try to ferment your glucose. At the same time, try to ferment your sucrose, your maltose, and even your mannitol. That will differentiate this one with your actinomycetem comitans. Again, in your actinomycetem comitans, only try to ferment your glucose but not your sucrose. And at the same time, this one is capable of beating the agar. So if you try to check the agar, it would have depression. So, pang depression. The gram stain result, this one appears to be rosette, swelling, filamentous in form, and usually that could be manifested in your yeast extract agar. Okay, then this also oxidase, okay, positive and catalase negative. But your actinomycetem comitans is oxidase positive and also catalase positive. This one is oxidase positive, oxidase positive, catalase negative. Okay, the next one, we have your Ichinella corrodens. So from the words of corrodens, try to corrode the agar, try to pit the agar. Ichinella corrodens primarily can be acquired by a bite coming from a human. You have your cleansed fist fight, or you can have here primarily due to the trauma because of a wound here or the break in the skin coming from the teeth of another person or patient. It's also tried to cause here cellulitis among drug addicts because of the inoculation of the organism to the skin, contaminated paraphernalia, okay, during the pod session. And then also try to cause serious subacute bacterial endocarditis. So we have here the characteristics of Bartonella corrodens. So siya lang ang non-fermenter natin. Again, that one do not ferment your glucose or any other sugar. Is also try to pit the agar, the same with your Cardiobacterium hominis. Ang pinagkaiba lang nila, this one try to again, this one, however, your Cardiobacterium hominis try to ferment your carbohydrates. This one do not ferment the carbohydrates. And at the same time, they're producing also yellow na colony characteristics. It's like in your actinomycetem comitans. And also try to pit the agar just like your actinomycetem comitans. Okay, then this one would have your characteristic na chlorine or bleach-like odor. And same din sila, oxidase positive, catalase negative ni actinomycetem comitans. Only that again, your Aggregate Bacter actinomycetem comitans, I mean your Cardiobacterium. So, ang pinakaiba nito sa Cardiobacterium hominis natin, again, both of them try to feed the agar. Only that your Cardiobacterium hominis try to ferment your sugar. This one is do not ferment the sugar. Both of them would have the yellow na colony. Okay, the next one, we have here your Kingella species. Okay, our Kingella here try to cause our acute or degenerative joint arthritis. We try to infect primarily the joint and the bones, occurring here in our children less than 3 years old. For the adult population, so most likely they get infected here with the manifestation of the endocarditis. Okay, we have here the gram stain result. This one appears to be Coccobacilli, square-ended, that may appear in pairs or even in short chains. This also try to ferment the glucose and try to pit the agar. So we have 3 species which try to pit the agar, the Cardiobacterium, Ichinella, plus your Kingella. So this one try to resemble here our Neisseria because it's able to grow in the selective media for your Neisseria, which are your Thyromartin, modified Thyromartin, your Martin Lewis. But then again, we can differentiate this one with our Neisseria gonorrhea particularly because this one is catalase negative. So catalase negative ito plus superoxal negative, which are in the case of your Neisseria gonorrhea, that one is catalase positive and superoxal positive. Pero siya negative lahat. Okay, we have here the two species of our Kingella. We have Kingella denitrificans from the words of denitrificans. It's capable of your nitrate reduction. And this one is the non-hemolytic na species. Kingella kinjay, on the other hand, this one is the hemolytic na species. Okay, now we go to the next one. We have your Capnocytophaga. The Capnocytophaga is eventually this one do not cause here primarily our endocarditis, but rather is more of it try to cause here our septicemia. So try to cause here sepsis or bacterial infections, and then that one is occurring here among patients having a decreased neutrophil count or neutropenic na patient. Laboratory diagnosis, so microscopic structure in the gram stain appears, this bacteria appears to be gram-negative Coccobacilli, but this one is square, that one is spindle shape, fusiform shape, okay, and with pointed ends that would resemble here our Fusobacterium. This one is highly motile, capable of gliding motility with the surface na solid agar. And you could also have a solid agar. It would have here adherent and try to produce here a yellow na colony which resemble our Ichinella corrodens. Only that this one do not peat the agar. That's how you differentiate it from your Ichinella corrodens. And this resemble also here the Hacek group with the carbon dioxide requirements. And the next one, we have your Pasoreta Maltose. This one is zoonotic. So most likely we get infected here by an animal bite coming from our animals. Bite of the birds or even the mammals. So we have your three manifestations, systemic. So when the bacteria try to enter your body, can cause your systemic infection in the form of your septicemia, arthritis, endocarditis, or even your meningitis. Also try to cause your pneumonic, so try to inhale. And we have also here subcutaneous skin infection if, again, bite. Okay, that's so the cutaneous infection will try to progress to become inflammatory actions and okay, would have here an exudate formation. Okay, then we have also here the gram stain result of your Pasteurella multocida. So this one appear to be Coccobacillus. Also appear to be ovoid or even filamentous. Also have here the bipolar staining characterized by, of course, the end part would have a dark stained area versus here the light stained area at the middle portion. Then we have here the SBA, able to grow on that, and even the chocolate agar, but not on your Makonki agar. So colony here able to grow after 24 hours producing a mucoid colony, but after 48 hours appear to be narrow green with brown halo surrounding your colony. The next one, we have here your Brucella species. This one is zoonotic then. So basically, we classify your Brucella here as your biological, category B, biological select organisms. So it could be an agent of the bioterrorism. So this one characterized here by easy to spread infection through your person-to-person contact. Because this one could be transmitted also by aerosol or even droplets. But this one would have your moderate mortality rate and would have here a decreased morbidity. So we have here the mode of transmission of your brucella. You get infected here by either oral, percutaneous, direct inoculation, or even aerosol, that's your airborne. Okay, so we have here manifestation of our brucella. So we'll have your acute infection. Consider here to be a non-specific illness characterized by fever, myalgia, anorexia, headaches. Okay, and usually this one occur here within 1 to 4 weeks of the infection. Then we have here the subchronic, we try to occur here within 1 year of infection. And you call this one as your angulant fever. So that's why, okay, so that's why this one would have here your undulating fever or your angulant fever. Okay, so this is characterized here by having a normal temperature during the daytime, But during the afternoon and the evening, the patient would have a high temperature. And this also end up with the presence of your arthritis and epididymoarthritis. The chronic infection tried to occur here more than 1 year of the infection, and this is characterized here by depression, arthritis, and chronic fatigue syndrome. Okay, we have here the microscopic identification. Gram stain result also appears to be Coccobacilli. And we have also here the growth characteristics. This Brucella can grow in your SBA, can also grow in your chocolate agar. At the same time, it could also be growing here on your other culture media like your modified thyre Martin Lewis. Okay, and usually, the bacteria here were able to grow within 18 hours of the inoculation in your culture media up to 4 days. So, up to 4 days ang reading time natin before we can release here that the patient's or the culture is negative for this bacteria. In our culture media, this one appears to be smooth, raised, and translucent na colony characteristics. And this one is intracellular pathogen, so could enter our mononuclear system, your macrophages, and try to multiply within that one. And then you work under, this is your biosafety level 3 because of course of the airborne transmission. Okay, we have here different species of your Brucella militensis. So this is the natural host here, goat or sheep. Then we have also your abortus in the cattle, so it's in the swine, and we have also canis in the dog. They can be differentiated from one another by the serum agglutination. All of them will give a positive result except your canis. H2S with the blackening of the colony by addition of your lead acetate as your indicator could only be occur here in your abortus and your suis. Urease tests, all of them will give a positive result with the urease, only that they vary here depending on their time of their production of the urease. Okay, it says 1-2 hours. So medyo mabilis itong dalawa. Less than 0.5 hours of colony growth, it will already have a positive result for the urease. Then we have also here your inhibitory test. Okay, we have your addition of your thionine will inhibit the growth of yours. Okay, abortus. And addition of your fustein, the dye, it will inhibit the growth of your suis. Okay, then we have here your Francisella tularensis. Okay, Francisella tularensis here is causative agent of your rabbit fever, deer fly fever, lemming fever, and water trap fever. So this one considered here as Category A, biological select organism by the national government. Because this one can be easy to spread through human-to-human contact. This one would also be characterized here by having a high mortality rate. You get infected by this one is also a zoonotic. Just like our, just like your Pasoreta Maltose, and we have also here your, what's the other one? Okay, there are also, okay, zoonotic. Okay, Pasoreta, Francisella, what's the other one? Wait, I check. Brucella. Okay, Pasoreta, Brucella, and Francisella, they are also zoonotic. Okay, so again, this one can be transmitted here by oral for ingestion, inhalation, arthropod bite, or even contact with the infected tissues. So we have your manifestation. You can have ulceroglandular, the most common one because of the bite. At the site of the bite would have your ulcer formation with enlargement of your regional lymph nodes because you have an infection. It also appears to be pneumonic, glandular, oropharyngeal, oculoglandular, or even typhoidal. So it would have the fever manifestation. Laboratory diagnosis. Gram stain, so it appears to be a Coccobacilli. So able to grow here in our culture media supplemented with your cysteine, and thiosulfate in order for that to grow in your subculture. This one also able to grow here in the following culture media: chocolate agar. We have also here your modified thyromartine. We have also here Martin Lewis. We have also here modified diamartine, buffer charcoal use extract, and even your trypticase soy bron. So colony appears to be smooth, raised, and we have also gray, white. And then this one could grow here up to 14 days. So try to check here the culture every day for 14 days before you try to report that one as negative if there will be non-growth on that. On the next one, we have your Legionella Neomafila. So this one has been named here as Neomafila because of the incident in 1976. There was an American Legion convention where the participants of that convention they got sick here, and they approximately 221 of them tried to develop pneumonia, and 34 of them died because of that mystery disease. And that's being caused here by the Legionella Neomafila. We have here the Virulence Factor. This bacteria can enter, multiply our macrophages, can also enter, multiply with your free-living na mga pathogens, including your protozoans. They can survive also here temperature between 20 to 43 degrees Celsius, even up to 40 to 60 degrees Celsius. Legionella pneumophila usually could be found here in the water system, like your lakes, your river, or even artificial water system, mga ornamental fountains. They could also survive on that. Most likely, they try to adhere also in the pipe system, and it try to be transmitted here by the water droplets. Legionella longbeachia, on the other hand, is being transmitted here by your contaminated gardening tools. Okay, we have your infections caused here by Legionella pneumophila, try to cause here your atypical pneumonia. And we have here also other bacteria which try to cause here atypical pneumonia. Aside from your Legionella pneumophila, we have your Mycoplasma pneumoniae and your Chlamydophila pneumoniae. On the other hand, your Strep pneumoniae try to cause here your typical pneumonia, and that one would have a different manifestation compared with your atypical pneumonia. Okay, our Legionella Neomafila try to cause here two types of main infection. First one, we have your Legionnaires Disease. Okay, Legionnaires Disease here characterized by the presence of the fever and of course pneumonia. So medyo delikado ito. That could be divided here as either sporadic infection characterized by community outbreak, your epidemic on the other hand characterized by short duration with low attack rate, and nosocomial, which is happening here, occurring among our immunocompromised patient. The incubation period of your Legionnaires disease is 2 to 10 days. They start here with your non-specific or non-productive cough, fever, headaches, and later on, it tries to infiltrate your pulmonary tract, producing here your bloody sputum and purulent sputum. And later on, also try to disseminate in our capillary system, our vascular system, by passing through your respiratory tract, which try to infect other part of your body, which are your internal organs. It could infect your liver, your kidney, or even your heart, and that's why it's more dangerous. Your Pontiac fever, on the other hand, is manifestation characterized by the fever without pneumonia. So it would have a shorter duration, so incubation period 2 days, starting with the flu-like symptoms, fever, headaches, and would have here, we try to last 4 to 5 days. We try to resolve after that one, and eventually the signs and symptoms still try to subside without your clinical intervention or without treatment. Okay, so that's a self-limited na infection. Okay, then we have here the specimen collection and handling. So for diagnosis of your Legionella pneumophila, you can have your sputum as your sample for that. You can also have your bronchial aspirate or bronchial washing. You could also have your small tissue. You need to add with your sterile water. Do not add NSS because the sodium in your NSS is toxic to your Legionella pneumophila. If there's delay in the processing of that, okay, or culturing of that, you can frozen the specimen at negative 70 degrees Celsius. On the other hand, we can also use urine as our sample here, especially for an acute infection, for your antigen detection. So if there's delay in the urine sample here for that antigen determination, you can store that one at 2 to 8 degrees Celsius as for the refrigerator temperature, or you can frozen that one at negative 20 degrees Celsius. Okay, microscopic identification characteristic here. So again, this is your pleomorphic under the microscope with your stained gram stain result. It's also weakly stained. So to remedy that one, you can prolong your saffron in your counter stain for 10 minutes. In the case of your Legionella Neomafila, so that one could be stained by your ASEFAS, your modified Kinyon method. Another test, we have your serological test, which will try to detect your antibody, your direct fluorescent antibody detection. Okay, our specimen for that is your lower respiratory tract specimen. So, more of ano siya, nasopharyngeal swab. And then we have your isolation. So, if your specimen sputum here, you try to prepare first here your acid treatment with your sputum. So, 1 part of the sputum, 10 parts of your 0.2 N KCl hydrochloric acid. Hydrochloride. Okay, then you can have your selective media for your Legionella Neomafila. So we have your buffered charcoal yeast extract with the L-cysteine or even plus the iron. Okay, so this one could also be incorporated. This one's been incorporated with antibiotics, polymyxin B, anisomycin, vancomycin, or cefamandol that would be inhibitory to your other organisms. Okay, then we have here the colony characteristics of your Legionella Neomafila in your buffered charcoal yeast extract. This one appears to be gray-white, blue-green, convex, or glistening colony. But if you view that one under your dissecting microscope, the middle portion would be the young colony, characterized here as gray, light gray, and that one would have be granular in appearance. The edge of that or periphery would have here either pink na color, light blue, or bottled green band with a forward appearance. Now we go to your Bordetella. We have your Bordetella pertussis and your Bordetella parapertussis. So we have here the different virulence factor. The first one, filamentous hemagglutinin or pertactin. So that one is could be found here on the outer surface membrane. So this one is serving here as its attachment receptor to allow that one to adhere to your respiratory tract tissue. So basically that one, okay, as its attachment mechanism or as its receptor, allowing that one to adhere to the surface of your tissues in order for that to cause an infection. Another one, pertussis toxin, we consider this one as an exotoxin. So this one tried to modify the host protein enzyme na adenosine diphosphate ribosyl phosphoribosyl transferase. Adenosine monophosphate ribosyl transferase, which eventually tried to inhibit here the signal transduction. Another variance factor, we have here your adenylate cyclase toxin. So this try to inhibit host epithelium and immune response primarily by regulating the supraphysiologic concentration of your adenosine monophosphate. The tracheal toxin, on the other hand, try to facilitate here try to induce cellulostasis, DNA damage, and eventually tissue death of the infected tissues. Okay, we have here clinical infections. So again, Bordetella pertussis try to cause here pertussis or you call this one as your whooping cough. Divide here into 3 stages. The first stage is your catarrhal phase, characterized here by insidious onset. This one would have your manifestation of your sneezing, coughing, runny nose, or even conjunctivitis. The next phase, we have here your paroxysmal phase. This is already characterized here by the whooping cough, pressed with the incident of your repetitive coughing spell with the woof at the end because of the grasping of the air. And lastly, we have here the convalescence or the recovery phase that try to occur here after 4 weeks of the onset of the infection, and it's characterized here by a decrease in the severity and the frequency of your coughing spell. So the patient's already about to recover, or this is already the recovery stage. Okay, then we have here the isolation of your Bordetella pertussis. The best method of sampling here or collection process the specimen would be your nasopharyngeal aspirate or swab. So for that, we are using here your calcium alginate or even your Dacron na swab. Okay, and basically, okay, transport media. So ideally dapat, if you try to collect the specimen, you need to plate it directly with your selective na culture media. But if not, you can have here a transport media. So if the transit time here between the lab and your specimen collection site is 2 hours or less than 2 hours, you can put your swab in your 1% casein hydrolysate. But your AMIs can preserve the specimen up to 24 hours. Okay, whereas your Regan Low here can preserve for more than 24 hours. Regan Low here primarily made up of the 10% horse red cell. Also contains here half strength of your charcoal, and that one contains here your 40 milligrams per liter na cephalexin antibiotic. Okay, incubation for that, we have 35 degrees Celsius here for 7 days. Okay, then eventually able to grow on that. Other culture media, you could also have here your potato, your Bordegengo, potato infusion agar. It would have the same formulation with our Regan Low, only that this one would have here a full strength charcoal. Okay, then we have your colony characteristics with your Regan Low. Okay, the young colony would appears to be smooth, glistening, would appearing to be a mercury droplets. But they try to age, become here gray in color. Whereas in your potato infusion agar, both your pertussis and parapertussis here would be appearing to be beta hemolytic. On the gram stain result, this would still appear to be gram-negative Coccobacilli. This is small na bacteria. And we have here the differentiation between the three species of your Bordetella. We have your pertussis, parapertussis, and we have also your Bronchoseptica. So first one, charcoal horse blood here. So all of them were able to grow. Only that this one after 3 to 5 days, after 2 to 3 days, after 1 to 2 days. Blood agar, so only your Bronchoseptica and your parapertussis able to grow in your blood agar plate or even in your SBA, but not your pertussis. McConkey, so able to grow in McConkey, catalase positive and motil is only your Bronchoseptica. Oxidase, except your parapertussis. And we have also here the urease test. So, negative ito. So, after 24 hours, we will give already a positive result with the urease. This one after 4 hours. Okay, so that's the end of this topic. Okay, thank you.